Hello, everybody, and welcome back to the Medical Mindset Coach podcast. I am your host, Star Freudenberg, and for today's episode, I'm going to lead you through to one of the latest and newest services that have been added to the repertoire of skills that I have that I think is really vital, really important, and really helpful to address quite a significant amount of issues. And that therapy is IV drips, or also known as vitamin infusions. And the best way to explain it is exactly like in a hospital when a nurse puts a needle in your arm and you have that pole with a big bag of fluids dripping either to the top left side of you or the right side of you. This has been transposed or carried over into the wellness setting because this is able to help you with many different things. Whereas in the hospital, you'll only be getting a bag which would have something called like saline solution or sodium chloride. Hello, everybody, and welcome back to the Medical Mindset Coach podcast. I am your host, Star Freudenberg, and for today's episode, I'd like to introduce you to one of the latest additions into my clinic that I'm very excited about. And probably the truth is I'm excited about everything because I'm very specific in what I study or I add because I understand the vast benefits that they offer, as well as a multi-purpose that it can address multiple issues, whether it might be for well-being, it might be for disease, it might be for even aesthetic purposes. But the point is it can address a lot of things. So drum roll, I'm adding or talking about today the therapy called IV drips. IV, everyone asks, what does that stand for? It stands for intravenous. So meaning intra going into the vein, right? Whereas you'll get the other modalities that I offer called shots or IM shots. That's called intramuscular. So going into the muscle, right? There's also different terms used for drips, also known as vitamin infusions or even IV nutrient therapy, so very interchangeable, but all actually the same thing, right? There is slight differences in what kind of drips you can have, which is the fun part. So, again, this can appeal to a vast amount of people for different reasons. So first thing I need to tell you, so when you go for a drip, you will be given a standard size bag, which is 250 mils. The sodium chloride is very powerful for hydration. And because of the nature of my work, and I deal with people who have, I'm going to go with the word significant dehydration or are not aware of how depleted their hydration levels are, what I offer in my clinic for the exact same price, or I would even say less, that people offer is I'm giving you a double bag. So I'm offering a 500 ml sodium chloride bag. So in order to help address the depletion of hydration levels, this drip is offering you, let's go like a double whammy in a very good sense. So the only difference then, excuse me, the only difference then is that what we require is just a bit of a longer time to sit in session versus just a quick in and out. But if you are in a rush, due to your busy lifestyle, due to whatever reason, we will still start with the same amount in terms of the bag, whilst adding all the different vitamins that you ask for, or, that I would recommend that would be good for you to receive. You can just, I'm going to say eat, you can just consume as much as possible. And then when you have to leave, then we will just call it at that. And even if you receive, for example, 300 mils, 350 mils, that's still more than what you would have received from just the standard bag, right? So what you will know is effectively at the end of the treatment, you're getting at least more than what a typical treatment would be. Which we want to just push towards working at pumping hydration into you, as well as a good concentrated amount of high quality vitamins. So let me just go into, actually, I just want to say this first. So a lot of people go, okay, well, why would I want to get an IV drip versus what is the difference between getting a shot intramuscular or just taking supplements? So there's quite a few differences, right? So if you have to choose between the three, the best one would be the IV drip, because that's going straight into the veins, straight into the bloodstream, straight into the various systems where the body can absorb the nutrients at a high concentrated percentage, right? When we go into intramuscular, it's still as strong, but it has to be absorbed through the muscle, and therefore a little bit of the efficacy does dilute. But still you get a very high concentrated amount. I can't tell you the exact percentage, but if you want me, and I'm just blabbing here, but if you want me to give you sort of just a visualization, because that's the way I work with visuals, I work with trying to see numbers, statistics, because my previous life I was an accountant. But it's technically this life, not previous life, just to make sure and be clear. But, IV drip, let's talk about, if we're putting 100% in, let's talk about maybe getting 98% absorbed, right? If you're getting intramuscular, my brain's thinking, okay, let's talk about we're getting like 86 to 90% absorption rate. When we go into taking supplements have to travel quite a long way throughout the body through the various passages. And there will be a lot of, I'm going to use the word obstacles, that will inhibit absorption. So one, how well is your digestive system working? How well is your absorption rate working? Because a lot of people that I deal with, and probably chronically around the world, people have some various forms and stages of malabsorption, not being able to absorb or extract the nutrients from your food as well as supplements, which I obviously work with people at getting better at. So the idea is, depending on the quality of supplement you get, so I recommend high quality supplements. They cost more. People and ah about it because they say, I can go to Hollard & Barrett and I can get a couple of these on a penny sale. But you have to understand, just like drugs, supplements are cut with fillers, right? Instead of cut with, I don't know what people said back in the day. Like, for example, cocaine would be cut with rat poison, or maybe the acid that you throw in a pool, baking powder, these kind of various terms that I've heard. The same is happening with supplements where they're called fillers. So you either get soy or maybe some dairy substitute just to make or fill up the capsule. So, for example, instead of getting 100%, vitamin B in a capsule, you might be getting actually like 10%, right? And the rest is filler. Now, obviously, if you go for high quality tablet, you'll be getting, maybe 80, for example, 80% of that. But now we've got to think about the processes of digesting it. First thing what happens is, as soon as it hits the stomach, we have something called hydrochloric acid in our stomach. That's going to dissolve the capsule and also break down some of the nutrients from that capsule. And now this is a factual statistic that once after it passes through, and then it passes through into the small intestine, this is the place where absorption happens, where your body starts to say, okay, I need these vitamins, I need this, to transport it to various processes throughout the body and the different organs, helping with the various systems. After passing through the stomach acid, only about 15% is actually then subsequently absorbed. Right. So people go, oh, phooey, like, why should I even bother taking a tablet then if I'm not even going to get it? But think about where you are and versus having 15% more of that. A lot of people, even if I even say, even if you're getting 1% more than what you have today, you want to take that because you're adding energy into your life. You're adding years onto your life because you're hitting into a phase which I call the maintenance phase. You're trying to support your system as we age, because as we age, we need more and more support. And you might as well get on it now so you're not having to fix a lot later, right? Which is really, really key. So you can see between the various options, you can do all of them. And how I like to work in the clinic is that we do a drip We can do it every so often, depending on your need. Intramuscular injections through the bum or the arm, for example, might be more regularly. Sometimes, depending again on the reason why you come, might recommend a course of 12 weeks where you just come in once a week. So various things people come for could be, depleted B12 levels. It could be you have some various autoimmune condition. You might have some skin problems such as eczema, psoriasis. You could have some heart or / cardiovascular issues, different autoimmune conditions. You could even have hair loss and looking to regenerate hair, because there's a specific one that I offer for that. Might even be for low immune system, so low immunity, maybe lack of wound healing, maybe poor circulation throughout the body. So various things that would come that I would prescribe to do a whole course on. And the answer is yes, I will still recommend to take some regular daily supplements, because there's some things that the IV drip doesn't address. But also, like I said, just to keep on it. So because with having a drip, this will do a huge boost in your system. But of course, the body's going to start eating away at those various energy offerings, I'm going to call it. And then you'll get back to that depleted state, but you'll be in a much better state than you were before. And then obviously having better energy levels, better moods, better hydration. You can obviously carry out processes a lot more effectively in your day-to-day interactions with the world, right? So I would say another thing to point out is, again, depending on the need, it depends how much you need of a certain, for example, vitamin. Whereas intramuscular, you can only do a certain quantity that's fixed because we're injecting in a muscle. And like, for example, in the arms, we can only do a certain quantity, which is usually up to 2 to 3 mils, depending. And in the bum, up to about 4 mils as well. So if we over inject, for example, if you had to put, I don't know, let's just use 7 mils into the bum, that can put you at risk of muscle atrophy, because it can basically eat away at the muscle. You can cause damage, it can cause scarring. And this is what has led to the IV drip, spontaneous understanding between us, because there we can put as much as we want to. And you'll understand this because if you see or have ever been in a hospital or seen on TV, people can be on a drip for weeks, months on end. It's obviously feeding the body. So, this is where it's okay. So if we need to do a super boost, then we go into the IV therapy. Just to get the technical explanation, because I know I get carried away because I love chatting. But, the question is, what is IV drip vitamin infusion? So as I've mentioned already, IV drip therapy is also known as intravenous therapy. It is the administration of delivering nutrients and hydration directly into the bloodstream for immediate absorption and use by the body. It is the fastest way, out of everything, like I've just discussed between the various options here. It is the fastest way to deliver nutrients throughout the body because it bypasses the digestive system and goes directly into the organs, resulting in a 90 to about 100% absorption rate, as opposed to, and they just used this, they used a statistic when I trained, about 20 to 50% possibly orally, right? So with 1/3 of the UK workers experiencing anxiety, depression, stress, all of the above, which has been documented by a PwC, which is an auditing firm, by the way, one of my ex-arch enemies, because I was a Deloitte, or we used to call ourselves Deloitian, a PwC survey. It's not a coincidence that there is a growing need for preventative and therapeutic IV vitamin clinics, spaces, centers, to be able to help boost energy levels and stimulate the immune system. And this is the thing there. A lot of people are putting down, or misunderstanding, I think is even the better way to say it. I've got low moods, I'm on my period, I've got cravings, I'm tired, I have mood swings, people don't actually put it down to, okay, I must have a nutritional deficiency, right? Again, it's not a popular common thing to be like, oh, that means I'm low in vitamin D. Oh, that means I'm low in vitamin B. Oh, da, right? So again, this is why you need to come to the experts to go, first of all, you need to recognize what's going on, going like, I feel abnormal because I'm behaving in this way that I don't normally do, or I'm really struggling to get up in the morning, or my mood drops throughout the day, or my sugar levels or blood pressure drops throughout the day, and I feel I need to grab, snacks, or even recognize your cravings, because that's going to also be able to identify. I mean, a very silly example for me, I will have at odd times of the year, all of a sudden I crave a donut. Then I think, oh gosh, like that's really strange. I never eat donuts. Why am I craving a donut? And what you need to first do, I always tell my patients to consider this and think about it. Dissect what you are craving, because this is your body's way of communicating to you, I want this, and in my case, a donut, because I'm depleted in a certain mineral, vitamin, fat, amino acid, right? Or all of the above, right? Whereas in my case, it was saying, okay, I need some fats in my diet, right? And that's a very yummy, fatty thing you can consume. And then I go, okay, cool. As soon as I crave that, I go, okay, I need to obviously now supplement myself with maybe some omega oils, maybe CoQ10 plus, maybe have some more olive oil on salads or sesame seed oil, something oily to supplement into my diet, because my body's telling me why I'm craving it. And I say that to you because most people, because of course this is what I specialize in, this is my therapy, this is my hobby, this is my work, so I really do have an in-depth understanding of things and what things represent and what they mean and what vitamins are and what fruits, veg, food, etc. But you may not. So who is your best friend? Monsieur Google, Mr. Google, right? So if you go, oh, I'm craving this, go on to Google and say, what is this thing made up of? And it might say vitamin A, vitamin B, C, D, fats, I don't know, the list is non-exhaustive. And start to go, okay, so maybe there's one, I can go to a specialist, just to say, and this would be either someone like me or a dietitian, a nutritionist. Someone obviously specializes in food and nutrient therapies, and say, okay, I've been craving these things. What's wrong with my diet? Or even use this now as an opportunity to go, oh, I didn't really realize that. Maybe I need to go see someone and start addressing, my various health concerns, because I've noticed now as the years are going by, I'm starting to crave this more, starting to feel more lethargic, starting to struggle to get out of bed, brain fog. I know I'm not drinking enough water, these kind of things that, like, I'm going to say they are your red flags, right? So, it's very interesting because a lot of people, they seem to follow the celebrities, like it's the craves. The celebrities are doing this, celebrities are doing that. So, if they're doing it, we should do it because they look hell of a good. So I want to kind of be like that. So although at the moment there is a craze that media is portraying IV therapy as like, I'm going to use it, the latest health craze, popular among stressed urban professionals or athletes, Hollywood celebrities, actually IV drip therapy has existed for quite some time, for centuries. And if or ever have come across IV drip therapy, you'll hear a very popular, I'm going to call them flavors, a very popular flavor called the Myers cocktail. And the whole reason behind why there's somebody's name on it, guess why? Because he's the one who introduced it, right? So IV drip is really nothing new in the medical community. So there is no crazy fad. It's not something that there's a hype at the moment and people do it and then it's going to disappear with time, just like every other various diet you might have heard of. Like I'm thinking Atkins, I'm thinking South Beach diet, these kind of things. Actually, dating back to about the 1600s, medical professionals first attempted injecting medications into the veins. Of course, I'm sure there were a few casualties, obviously through that experimentation, but obviously there has been some success as it has now evolved into being able to offer it in a very safe practice kind of way. But when it was first done in the 1600s, it did subsequently get abandoned due to poor hygiene, right? But obviously it has been revived. But when it did happen was during World War One, because IV drip therapy became a life-saving treatment, which sort of was around the 1960s when a doctor called Dr. John Myers developed the world-famous cocktail of vitamins and minerals. That IV drip therapy is well known as today, and it has really taken shape since. And obviously since then, a lot of, I'm going to use exploration and experimentation has happened to see what different vitamins and minerals are, helping people, again, for, like I said, various illness, wellness or aesthetic purposes, and what it can do. So, again, a couple examples. I can use one that can help you with your hair, skin, and nails. One can help you become more radiant in your skin. One can help boost your immune system. One can help you recover from sports performance. One can help you burn fat. One can help you get seriously hydrated. One can help your depleted sugar levels. Maybe if you're like a diabetic and something has happened, or you have like an insulin, spike, and then it drops significantly. This can then also help with that. This can also help with, I'm going to call it energizing. It can be help with vitalizing, energy levels, can help remove brain fog. There's just so many, various ways that it can assist you and help you in. Again, all you have to do is ask. But there's also a very popular one, of course I should have mentioned this first, is the hangover cure. That also is very, very interesting. So you'll see it's quite popular, a lot of different things. But if you have a massive hangover, you should definitely come, or know, like if you're going to have a massive stag do, hen do, or something of the sorts, and it's going to be a really bad one, like the movie Hangover. You're going to wake up the next day and you don't even know who you are, where you are. Already have this thing booked in, because this is going to be your recovery solution. And I'm going to go as far to say that even if it's not just drinking, even if it's drugs, we want to flush things out your system as fast as possible, detox you, boost you, hydrate you, and get you back on track. So this is really, really one of the very best ways to be able to help that. And the best thing is we can do multiple people at the same time, right? There'll obviously be like, maybe I'm going to say like a 10-15 minute lag between, but then the idea is that you're going to be sitting with the treatment, you can be chatting, present, or alternatively you can lay down, relax, chill, even receive another therapy. Like popular one is like reflexology, maybe energy healing, or even doing some other therapies such as a bioenergetic scan that I offer, so you can talk about, different various health things. We can go through your diet, nutrition, we can be like a 2-in-1, 3-in-1 kind of thing, because I always find that to be more effective, right? But now benefits, or like, why do people use IV drips? So like I've harped on quite a lot, there's a lot of various reasons, or multi-purpose, or several purposes that can include why people use drip. But I think the most prominent one at the moment is hangover relief, athletic performance recovery, enhanced athletic performance, immunity boost and support, cold and flu relief, inflammation, digestive issues, exhaustion, help improve vitamin and mineral absorption, fights toxins in the body, combats dehydration, recover from food poisoning, eliminating jet lag, which is very common because I have a lot of international or business people who travel quite a lot, eliminating nausea and vomiting, energizing your skin, enhancing your energy and mood, anti-aging or slow down aging, increase weight loss, treats migraines and headaches, restoring lost nutrients and rejuvenating the body, energy boost restoration, most common one I'm dealing with at the moment is combating long-term COVID, improve reactions to allergies, slash intolerances, improving your sense of well-being, combating exhaustion, improving mental clarity, brain fog, relieving stress, easing symptoms of menopause. I'm just trying to think of what more I can say. There's so many. Even helping improve cholesterol problems, which is another big theme that I'm dealing with a lot of people at the moment. So the list is massive. And again, I hope that would attest to why you should definitely do it, right? So, and the best part about this is now you don't have to go into a hospital to receive these kind of benefits, right? So we can do this in the clinic. But yeah, most important at this time, I think, is just to make sure everyone has a high, strong, well-working immune system and overall general well-being. Well, this can enable the person to get that much-needed boost, which makes things quick, efficient, realistic, and it's practical as well as accessible, right? Because you don't want to get sick, especially, in this case, as winter is just around the corner. So we need to be able to do that. So how does the therapy actually look like? So it's kind of going to be like the same like you see in the movies. You're going to be laying on the clinic couch or the massage table bed, but instead of laying flat, I'm going to angle it up at a certain degree. That will basically be like you're sitting up in bed. We're going to put a pillow under your arm that you're going to be receiving the needle inside. So T's and C's kind of are, if you're not great with needles, not great with blood, but you want the treatment, just look the other way, right? We're going to get it into a point where it's going to look very presentable after I ensure that, that we get rid of any, maybe you might have a little bit of blood dripping out or anything that I laugh and say it'd be seen as like inverted commas horror movie. You just look away. It's pretty clean, straightforward treatment. Get the needle in. And then I'll take the needle out and I'll just leave a piece of plastic in, which is like a fake needle, which the needle specifically is called a cannula. So I'm doing a cannulation therapy. So your arm will be slightly bent. And the idea is why we remove the needle and put this plastic needle inside is just that if you need to move your arm or, something happens, your arm drops or you get, a bit lazy or twitchy and you want to move or even just play on your phone, that kind of thing. This enables you to be able to do that versus some people do IV drips with a needle called a butterfly. And then there's this literal metal needle inside you and that gives you limited mobility, which I don't really think is the best one, right? And also more pluses with the cannulation is that you're able to absorb a lot more at a given time rather than a slower rate, what we call it a drip rate, which is quite useful. I'll cover you with blanket. Again, another T's and C's for this treatment, which most people have the opposite, is you have to make sure you eat within a 2-hour window period straight before the treatment, and to be well hydrated so your veins can be quite lush. Some people, unfortunately, don't have great veins, and that might mean you might not be able to do the treatment, right? So I've introduced kind of the same concept like people do like a patch test, and do like an IV drip vein test, if you will. So I prescribe it as a 15-minute consultation. So you come in, we'll check your veins if you're not sure. But most people traditionally kind of know or have had their blood taken before. And the phlebotomist / nurse / doctor usually gives the feedback going like, oh, wow, you have really difficult veins, or you have really hard veins, or wow, you've got great veins. Like there seems to always be a commentary that, leaves that echoing feedback in a person, and they'll be like, yeah, no, they always struggle to take my blood or this or that. So it might be that one of the other options is one that maybe you don't qualify because your veins are too difficult, or two, we would look at doing actually the butterfly needle, so the one with the metal, but I'd just be placing it in a different area on the arm. And it would require just to be a very slow drip rate. So basically what I'm aiming to do is I charge for the consultation, and then from that money, that if you qualify, will be acting as a deposit towards your IV drip official appointment, if you will. All right. As mentioned, so because I'm doing a double drip bag, I make sessions traditionally with a normal bag would be about 45 minutes or so, but I make my session about 1.5 hours. But again, just mentioned, if you are tight for time, we can do a shorter session and just see as much as possible that your body can take in. When the session ends, I just ask patients, as soon as we're out, literally the clinic room, that you just sit outside in reception, maybe about up to half an hour, just to make sure you feel okay. See if you have any reactions, any symptoms that, can happen. Very rare, but, we're always dealing with the, that one person scenario. Then there is a receptionist available. I'll be on the other side of the room just to say, like, if you need any help or support, maybe call you an Uber. If in the very rare cases, because we would do an in-depth medical form, check everything is fine or contraindicated, then we would say, okay, let's call an ambulance, for example. But again, this is worst case scenario. Because, we don't want you to faint or have any, issues, of course. We're going to be high risk, avoiding high risk situations. Then you can just sit. If you say, okay, I'm fine after 15 minutes, then you can go. Absolutely no stress, no problems. And then always, as always, hydrate throughout the day. Right? Common questions like, how many sessions do I need to treat my issue? So it's really complicated, this answer, because I treat everyone as a unique vehicle, a unique body, because we are, right? We do things very differently to other people and how we've been raised, our constitution, our makeup, the decisions we made, the food we eat, the places we surround ourselves in, the stress we involve ourselves in, the amount of exercise, etc., right? So again, depending on the need you're coming for, maybe we can do in one session hangover therapy, and then it's done, right? And then you're, inverted commas, cured, right? But maybe for treating certain conditions, it might require 2 treatments or 3 treatments or 4 treatments. But again, I'm working on a case-by-case basis that we're going to gauge by, okay, let's see how you are after the first one, some feedback, on your day-to-day, then versus the second one. But at minimum, sort of with everything I do, I always think 3 sessions is always good. The time spacing between them, that's going to be subjective. And again, that's going to be through the consultation process on how we would do it. But again, if you need a time frame, I'm thinking between either doing, monthly sessions, and then we can spread it out, then even to maybe every 3 to 6 months. Good to be doing it at least once a year, at minimum after you had your boosters. And then again, when you have done them, you'll understand the benefits and the healing, and then you come as and when required, right? And again, might depend on your lifestyle. If you're very, very active and you go out and you drink a lot and you eat really bad food, you travel all the time, maybe you need to think about coming more regularly. But again, subject to case-by-case basis for the person, right? And then again, for the treatment, I just ask you to just bring a nice bottle of water for you, sort of at room temperature, because I don't advocate at all to drink tap water, and I've learned since that people are very specific about the kind of bottled water or /filtered water they drink, right? Now going into the specifications about, who cannot do the treatments. I'm going to read the contraindications list to you, and then you will let me know. But anyway, the point is you'll still be doing a medical consent and questionnaire form that would be able to indicate this. So one thing I want to ensure, because I always do make people do an online consent form prior to arrival into clinic, because I really wouldn't enjoy myself, carving out the time, changing work hours, or not committing to an activity for this, and then you come to the clinic and they go, oops, sorry, you can't do it. Whereas, if you do the online form, I check it in advance and I'll be like, sorry, actually, you're not right for this treatment. Maybe we could do something else, or start here until the point maybe you can actually do it. If the contraindication is obviously flexible in that sense. But if you have like a hard limit where it's like, no, you can't do it at all, then okay, cool. We have to consider various other options, which I have in my basket, that we can try and help you get better wellness, right? So the various contraindications are, if you have an allergy to it, it's one of those things you'll try it once, or you had a reaction to it, and then they'll say, okay, don't do it again. Or you can even have an allergy to a specific vitamin or nutrient, which again we would check through kinesiology. And then obviously we would not be able to use that one, but we can use different one. A very good example is a condition called hemochromatosis. So basically there's an issue with iron absorption throughout the body. And in order to absorb iron, and when I say there's an absorption issue, it's an over-absorption. And in this case, in order to absorb iron, vitamin C is needed. So what we need to make sure is that you don't put a vitamin C in the IV drip bag, for example, then, to ensure that you don't have a varied absorption rate, because then basically I'd basically be reducing the lifespan of someone, right? But good thing we have the kinesiology to be able to test the vitamins and minerals, right? Next one would be cardiac arrhythmia. Even if you're currently on medication, that might have a contraindication to the drip. If you're acutely unwell, like you can't even move, kind of bedridden, you can't think straight, because all therapies require a bit of energy, and this would mean it's not the suitable time, because we don't want to stress the body out any further. That might be consuming the energy levels that you would have needed. Cardiac failure, excessive substance abuse or addiction, Leber's disease, kidney problems or kidney disease, liver problems or liver disease, hypokalemia or low potassium levels, deficiencies in other nutrients, particularly in folic acid and iron, because there's 4 key vitamins / minerals that will affect blood oxygenation levels as well, which is B9, aka folic acid, B12, iron, and vitamin C. So if you're depleted in a couple, your veins won't be very good or strong and won't receive the drip well. So it makes it difficult to do, and we don't want to cause any issues, complications, or not give you the effective treatment. So just say that it's not ideal. So in this case is one of those, we'll get you on good supplementation, maybe a couple injections, get your system working better, and then you can then come to the treatment. If you have a sensitivity to cobalt or cobalamin, like B12, if you have increased red blood cells or megaloblastic anemia, if you're pregnant or breastfeeding, currently on antibiotics, allergy to metal, because of course we're putting a needle inside, are you on blood thinners, any infections, iron deficiency, taking methotrexate, polycythemia vera, I can't say this word, polycythemia vera, which is a blood disorder, or a tongue twister in my case, or okay, you might have a history of gout, uncontrolled diabetes. If you're currently undergoing chemo or radiotherapy, you'll have to get the permission of the GP / consultant. And if you're over the age of 60, there is risk that you might have more of an impaired kidney function, so you have to avoid certain nutrients or amino acid formulas. And if you are currently undergoing or taking antipsychotic medication, so if you have some various form of mental health issues or disorder that you're heavily medicated for, we don't want to introduce different nutrients and vitamins that would interact with the medication. So this would be very, very important, again, to disclose and see if the certain or prescribed medication that you're on actually does is allowed, because again, we don't want to go against what the GPs or the psychiatrists are prescribing, because it's very, very key, right? We want to improve you, not make you worse. So I think that's basically about the IV drips. I'm really excited to discuss it. So when I first started doing drips, I don't even know how long ago, a few years ago, I thought it was a bit strange at first, just thinking like, oh, someone putting a needle in, what is this going to do? But then with a couple of subsequent sessions, I really started to notice the benefits. It's not one of those benefits that you're going to notice next day after your first session, because your body's going to need to absorb it. It's going to start to do a lot of internal healing. And then obviously with follow-on sessions, you're going to start to notice the external benefits, improvements with mood, improvement with energy levels, starting to radiate, starting to function better, operate better. So as I've mentioned, ideally I'd like people to do at least 3 sessions. But on that note, if you have any questions, if I haven't answered anything, if you want to know something more, alternatively even want to come in for a session, or as I've said, even a consult, please do let me know. And again, you can contact via my website, which is www.medicalmindsetcoach.com. Or even just go straight on there and just book in the consult and come through to the clinic, which is based in central London in an area called Monument/Billingsgate next to Tower Hill. And then / London Bridge, actually more prominent. And then we can take it from there. But this is something I'm really, really, really excited that I've been able to now introduce into clinic, because it's taken quite some time to be able to learn the trade and be able to administer, because it is a medical treatment. And I'm looking forward to sharing that healing and wellness journey to those who are going to significantly better their lives as a result from it. And we'll take it from there. So on that note, I am wishing you a wonderful day / evening wherever you are in the world. And next episode, I'm looking forward to talking about, well, I don't know if it's something exciting for people, but, something very concerning for people, about hair loss, right? A couple of new things coming into the clinic, or have come into the clinic, to help people with hair loss. There's 2 different or 3 different things we'd be able to do, especially now, because there is, I'm going to say not statistically proven, but there is a strange, I'm going to use phenomena, that has happened, that since COVID has come into play over the last few years, and especially since people have been jabbed, people have noticed a significant reduction in hair, or noticed hair loss, whether it's in the shower or brushing the hair, falling out, alopecia, that kind of thing. I can help with that. So if you want to know more, please stay tuned for the next episode. And I am wishing you over and out. Bye.